Hey, this is Dr. Neal Schwartz. Today I'd like to talk about the very common problem of dark marks and red marks that are left on the skin after acne. One of the most common conversations I have is with clients or prospective clients who are concerned more about the dark marks and the red marks than they are the pimples themselves. The conversation usually sounds like this: Dr. Neal, I'm no longer having acne, or it's very minimal or occasional, but now I'm very concerned about the marks that are left behind from my prior acne condition or from my occasional bumps that come monthly or every other month. Today I'd like to address this common concern, and hopefully this video will clear up this conversation for everyone who is concerned about dark marks worldwide. So here's how the discussion begins. We'll do a little question and answer. I usually ask clients, and I'll ask you since you're watching this video, which is more concerning for you, the dark marks or the bumps? Feel free to answer. If you said the bumps are more concerning for you because they are the ones that are creating dark marks, knowing that if you keep getting bumps, you will keep making new dark marks, thus having dark marks for a lifetime, you understand dark marks. If, however, you said you are more concerned about the dark marks more than any occasional, infrequent, or even tiny sandpaper-like bump that's on your face, this video will help you get your head around this emotional situation. It works like this. A pimple is an inflammatory process. Inflammatory cells go to the area and tissue gets red hot, bothered, and infiltrated with blood and immune cells. In this process, the pigment cells of that area of skin also get inflamed, and they put out pigment in the same way your pigment cells put out pigment when you get a lot of sun exposure. Therefore, when you get an inflammatory bump or even a scratch or a burn or anything that will inflame the skin, if you have slightly darker skin, you will have a dark mark that follows that represents a small tan or a wound that is healing that's also tanned. The red marks without the dark marks are just the wound healing. Just like if you cut yourself, that wound needs to heal. The dark marks are a wound healing plus the addition of the pigment, which is like a tan. So, if you get any pimple, tiny pimple, sandpaper-sized bump pimple, large pimple, if you have darker skin, it's going to likely follow by some sort of dark mark. If you have lighter skin, you won't have as much pigment, but you'll still have the wound that needs to heal from the prior inflammation, and that is the red mark. Either way, it's either a wound healing conversation or a wound healing plus a tan conversation. In reference to the dark marks that are on your face, how long does it usually take for a tan to go away if you've ever had a very significant tan? Now, when I usually ask people this, some people say, with darker skin, say, I've never really had a big tan, or I never noticed because it wasn't as dramatic. But I will tell you it takes about 1 to 3 months for a tan to cycle through and for your normal skin color to come back after getting a lot of sun exposure. That's true for most people. So here's the next question. If it only takes 1 to 3 months for a dark mark to fade, typically, how is it that some people have dark marks for 6 months, 12 months, or even many years? The answer to this question is because there is still some activity on the face, creating new dark marks in a similar area, thus giving the acne patient the idea that they are dealing with the same exact dark marks, when in reality, they are dealing with new dark marks that keep cropping up in similar areas. There is an exception to this situation. What if you have a dark mark from prior inflammation, but the same bump inside it keeps refilling on a regular basis, so that it never actually comes out and it never fully goes flat? You have what I would call a dark mark with a small tiny bump within it. If this is the case, This dark mark will not fade in 1 to 3 months. In fact, it will never fade until that bump is gone completely. From the moment it goes completely flat, even under magnification, that is the day that you could count 1 to 3 months for the dark mark to fade. This video is to understand and to explain dark marks. But let's get into the emotional situation here. People hate dark marks. It drives them crazy. It's a similar emotional reaction to having anything on your face. You want it gone, and you want it gone now. Because of this intense frustration, there are many products and procedures that are being directly marketed to you to remove your dark marks. And here's the reality about them. They all work to minimize the current dark marks. However, they do nothing for the existing tiny and occasional bumps that come up once in a while or are very, very small that can only be seen under magnification. And because they do nothing for your bumps, they will do nothing for your dark mark situation as a whole, and you will not find emotional satisfaction if you chase your dark marks while your skin is still active, even if only occasionally active once a month or once every 2 months. Do the math. If a dark mark takes 3 months to fade, but new bumps are coming every 1 to 2 months, eventually you will accumulate dark marks in numbers and you will be covered with dark marks because of the pace of which it's resolving versus the pace in which they are forming. Hope that makes sense. I'll explain this in many ways, but the basic concept is, if you keep getting tiny bumps, even occasionally, you will have dark marks for the rest of your life, regardless of how much money you spend or how much effort you do to remove dark marks. That is the reality of life. That is not even my opinion. I am just bringing the reality to this video. Some of my other videos I'll be making will be my opinion. This video, however, is just me bringing forth the reality of dark marks and red marks. They are wounds and they are a tan, and no one likes them. But to get your head around them, you have to understand what is causing them. And it is the pimples. Now, I run into many people who tell me, Dr. Neal, seriously, I do not have any acne at all, and I've had these dark marks for 6-8 months. What can I do? And here is my response. I suggest you go onto the website, go into Acne Analytics, take a highly focused photo, and zoom on this photo 3 or 4 times and look for the tiniest of bumps, even sandpaper-like bumps. If you find them, you will realize your skin is still active. If for some reason, even after looking under magnification, you feel you don't even have sandpaper-sized bumps on your face, and you don't get occasional bumps once a month, feel free to send me your cropped photo with just the dark marks, and I will view them and let you know what I think. Okay, now that we've explained red marks and dark marks, I'll ask you again, and I'll give you a chance to really think about it before you answer. If you've had dark marks for more than a year, and they are really upsetting you, which do you think is your main medical problem? A, the dark marks, or B, the tiny and occasional bumps that cause the dark marks? Take a moment with that. If you said B, the bumps, you now understand that your only mission is now to stop the bumps so that you don't get dark marks. We do that here using the starter kits in the Acne Bootcamp program. Feel free to email or call me about these starter kits, and feel free to engage in a program that is aimed at first stopping and completely inactivating all the bumps. The kits also help resolve old dark marks, but not until the bump count is really at 0. If you said A, the dark marks are still your only problem, I recommend watching this video many, many times. I'll demonstrate how dark marks are faded using some photos that were taken in the practice. So here we have a photo from a video I made a couple years ago, and this client, like many others with darker skin, came in and asked me, what can I do about these dark marks here and here and here? They were upsetting him. And I told him, will have to take care of his overall skin, including all these bumps over here, if we want to stop the new dark marks from arising. And that by just treating these dark marks here, he'll end up with more dark marks over here next month. And so that's what we did. And we can see in his progress report that his skin was inactivated first, and all we have left is this tiny little bump here and maybe some scarce tiny plugs over here. But overall, you can see how much better the texture is of his skin, and of course the dark marks that were bugging him faded as expected, since they were just a wound and a tan like we spoke of. Now when I go back and forth now, look at both the dark marks and the general texture of the skin and the small bumps. If you focus just on the dark marks, you'll be chasing dark marks for the rest of your life. If you focus on the general skin and the prevention of bumps, you have a chance to completely clear your skin of all dark marks. All right, hope that helps. To help others who are also suffering from this problem, please spread this video so that everyone in the world understands what dark marks are and what red marks are, and they no longer try to wash them away or magically remove them with bleach or any other procedure.